We are on.
Hello, everyone, and welcome to the online event, The Power of Partnerships, Advancing Gender Data in the Context of COVID-19, co-hosted by Data2X, Open Data Watch, and the United Nations Economic Commission for Africa, or UNECA, as part of their Gender Data Network initiative. Thanks so much for joining us today. If you participated in previous events put on by the Gender Data Network, welcome back. And if this is your first time joining an event put on by the Gender Data Network, we're so happy to have you. My name is Kelly Rogers. I'm a journalist for DevX, and I'll be your moderator today. So today's webinar will bring together experts and partners in the gender data ecosystem, from foundations to international organizations to national statistical offices. And we'll be discussing some actions that are already underway to really power partnerships in gender data, including the power of networking, advocacy, and raising the profile of gender data during the pandemic. Because as we know, the lasting consequences of the pandemic are leaving NSOs with the need to really innovate and adapt quickly, both in terms of data production, but also in terms of disseminating data that already exists. And so this is definitely an important opportunity for NSOs to really maximize the moment of this increased demand for gender data. And in order to successfully meet users' needs, but also to really promote partnerships and build up the reputation of NSOs and build that trust between data producers and data users. So we have a great 90 minutes ahead of us, and just a few notes on how this event will proceed. So we will first hear from special guests from UNECA and Data2X, who will provide us with opening remarks. And then we'll dive into the discussion with our distinguished panelists who are with us today. And then, of course, we'll hear from you, our audience, gathering your questions that we will gather through an interactive Q&A and pose to our panelists toward the end of the event. And a few quick notes, the webinar is being recorded, so don't worry if you're a note taker like me. You'll have that video and the recording available, and it will also be posted on the webinar partners websites. And then second, on the right hand of your screen, I'm sure many of you are very familiar with this by now, but you'll see a chat box. So as we move through this online event, please just note any questions, the panelists that you have, and we will revisit them during the Q&A and select a few to pose back to the speakers in the last part of the session. So with that, I would love to dive right in and introduce our first series of speakers. So we are so pleased to be joined and to welcome Vera Songwe, United Nations Undersecretary General and Executive Secretary for UNECA. She'll be opening the session for us with a few welcoming remarks, followed by Oliver Chinganya, who is the Director of the African Center for Statistics at UNECA, and Emily Corey-Pryor, who is the Executive Director for Data2X. So this trio will open today's online event with a few words on their roles in the Gender Data Network and their thoughts on the power of partnerships. So with that, I'd love to welcome Vera. And Vera, I do want to make sure that you are unmuted so that we can hear you.
Sorry, yeah. Can you hear me now?
Yes.
Wonderful. Now, so thank you very much. Good morning, good afternoon, good evening. Hope you're all well where you are. It's an honor and a pleasure for me to be here today with you on behalf of the ECA, the Economic Commission for Africa. I want to start, first of all, by commending everybody who is taking the time out to come and listen and participate in this conversation. It is an important conversation on data and gender. If we don't know, what the issues are, it's very difficult to decide and to come up with policy advice. And let me also thank, of course, the organizers of the panel, ECA, and the teams and DevX as well for doing this. The theme, the power of partnerships, advancing gender data in the context of COVID-19, as you have already said, is quite an important one. We want to focus on gender. I think everybody keeps talking about, the importance of women and the incidence of COVID on women. I tend to say that women are at the front of the COVID-19 pandemic and also at the back of it, as nurses at the front and at the back, because we get left out of many of the economic stimulus packages that are being given across the world, including in Africa. Ravaging our core assets, it's pushing more and more people into poverty, and most of the time it's women, single household women, that are affected the most when we hit the crisis. We're beginning to get some evidence about, just exactly how much, this is hitting women. WHO has come up with some numbers that say that 40% of the COVID-19 cases are women in the Africa region. This is just initial data. As the pandemic continues, we hope to get a little bit more data, and hopefully we have a breakdown of that data between younger women and older women. The burden of the pandemic on women is of course visible in also the job sector. We know collectively across the world that the sectors that have been the most hit are the service sectors, hoteling, entertainment, which is sectors that tend to have more women working in them. So again, even on the economic side, on the continent, a lot of women involved in cross-border trading have been affected. So everywhere you turn, and where we find a huge impact of COVID-19, we see women at the fore of that problem. So really, I think having this conversation so that we can unpack, one, just how affected they have been, but also then what kinds of policy measures need to be put in place is important. In Africa, of course, 74% of the women's employment is informal. So we also need not only to understand the problem, but to also understand how we get to them, because with informality, as we've mostly been having in these conversations before COVID, we were talking about giving women digital ID and ensuring that they're fully participant members of the sort of economic activity. Now COVID has come and they're no longer participating in economic activity, and we don't know where to find them. So it's sort of, we need to see ways in which we can maybe speed up the process of trying to re-identify women that have been affected by COVID, and those who are doing well, so that we can continue to stand them up. Because it is true, when we talk about data, we tend to just talk about the negative parts, but there are a lot of women that have taken to producing masks and test kits and providing additional services, home supplies for food and things like that, that need additional financing to stand up new capital, a new capital for new businesses that they've created. And so we also need to know where they are so that we can support them. So I think it's on both sides of this policy support agenda that we want to come on the safety net side for those who have fallen into poverty, but also on the financing side, empowerment and availability of additional resources for those who have been able to stand up and create new and innovative platforms for business and or even social support. There's been huge community social support happening in the rural areas, and a lot of it through women's groups and women's organizations, and those too need support. And we hope that with the data that we'll be able to collect, we can use that to increase and support those communities even more through platforms like this and through your membership. I'm not going to be long. I think you already know I'm speaking to the converted, I'm speaking to the willing. More than ever, gender statistics are central to our decision-making processes. If ever there was any doubt, I think let there be no more doubt. This is a key month for highlighting the importance of gender data. And so the statistical events that are taking place across the world, the United Nations, the World Data Forum, the Statistical Commission for Africa, World Statistics Day, I think continue to highlight why we need more data. I think it's also important for us to showcase the data that we already have. Almost as we always talk about, the negatives on women, we always talk about the negatives of the data we don't have. I think it's important with the data that we have to start making policy and start supporting, I think, activities around that, just to show the importance of having the data, because if all we do is just talk about the lack of data, it's very difficult to get more people around the conversation. And particularly in the gender angle, there has already been quite an amount of data collected, and it is important that we start using that for good. So hopefully this conference will do a little bit of both, highlight what is still missing and showcase what we have already and how policy can be informed by it. So once again, thank you very much. Let me assure you in concluding that ECA, of course, is committed to the agenda of data. We're committed to the gender agenda, and we hope to continue to work with you and hopefully more groups around getting more data for gender and gender analysis and policy making. Thank you very much, and very happy to participate, and I wish you all the best for the next sessions. Thank you.
Thank you so much, Vera, for those remarks, and for reminding us definitely that how important it is to look at the data we already have, but also linking that data to policy support. And so Oliver, I'd love to invite your thoughts next.
Thank you very much. I also want to thank the Executive Secretary for really opening this session. Let me join her in welcoming everyone at this webinar with the theme, The Power of Partnership, Advancing Gender Data in the Context of COVID-19. in my capacity as Director of the African Center for Statistics at the United Nations Economic Commission for Africa. I'm extremely pleased that I have my boss in our midst, the Under-Secretary General, and as well as the Executive Secretary of ECA, Dr. Vera Songwe, who has already highlighted the importance of gender statistics in a keynote address. Let me also welcome all distinguished guest speakers and thank them for their participation. Of course, I would like to extend my thanks and gratitude to Data2X, Open Data Watch for their active collaboration in the Gender Work Network project and the organization of this particular webinar. In the last decades, the demand for specific data indicators incorporating a gender perspective has increased and includes decision makers at a very high level in every area of social and economic development. There is great general awareness of the need for a gender perspective in development policy formulation and for the corresponding need of pertinent statistics. And this has become evident that reflecting the differences between men and women, as we've heard also from the Executive Secretary in official statistics, strengthens and improves the whole statistical system. Indeed, it pushes the improvements in the concepts, methods, topics, and data series to reflect better the activities and the contributions made by women as well as by men. The result of such efforts is often not simply better information on women and men, but improvements in measuring the realities of economic and social life. Let me assure you that the African Center for Statistics at ECA, as you've heard again from the Executive Secretary, is fully committed in improving the gender statistics in the continent. Our first core function is to strengthen the capacity of national statistical systems to produce, disseminate, and use disaggregate data and statistics with a gender dimension to facilitate evidence-based policymaking, planning, implementation, monitoring, as well as reporting. Partnership is also at the core of our work. Since 2012, under the Africa Program on Gender Statistics, we work in collaboration with the Pan-African Organization, in this case, the African Development Bank, we have the AUC, and many other development partners in gender, including UN Women, Paris 21, Data2X, Open Data Watch, to improve efficiency and the duplication and avoid duplication of the work that we do. We all know that the global crisis brought by COVID pandemic has increased the challenges that African national statistical offices are facing to produce reliable and quality statistics, and the need for quality and timely sex disaggregate data in more urgent than ever. You may know, as I speak, we also been running the Africa Statistical Commission that is also discussing exactly the same issues on how to address some of these areas. And these demands for national statistical offices to fulfill, and particularly on the gender data focal points within their offices. To support the national statistical offices in addressing these challenges, the center has conducted a rapid assessment on the impact of COVID-19 on gender statistical work of African countries. What comes out of very strongly is that the demand for real-time gender data for decision-making has increased. But at the same time, the national statistical offices have reported funding in general, and more so for gender statistics has decreased as funds are being channeled to preventive measures and health needs of staff. The assessment also shows that the capacities and gender data gaps are not uniform among countries. For example, some countries such as Malawi have experience with phone surveys, and some such as South Africa are more advanced with the processing of administrative data. Two alternative ways of collecting data that are becoming in time for the epidemic indispensable when face-to-face interviews are not possible. While in some countries such as Botswana and Cote d'Ivoire, no gender-specific surveys are undertaken, and gender statistics are limited to data disaggregated by sex. This shows very clearly that the relevance of this webinar today, as well as initiatives such as the Gender Data Network, in these times of global crisis, for countries to learn from each other, exchange knowledges, and good practice, as well as to encourage countries to push boundaries to explore new ways of doing things. The webinar is indeed timely, and I think looking forward to the interesting discussion that is going to discuss this in the next 80 minutes and ensure that they all contribute in supporting countries in their query for to address data challenges identified in the ECA assessment. In conclusion, before I pass on the floor to my colleague, Emily, I would like to encourage countries to take the appropriate actions towards the improvement of gender statistics, especially in the pandemic context. I would like to acknowledge that the important role of gender are focal points within the National Statistical Offices to be champions of finding and implementing solutions. And finally, let me say that I hope that the gender network, the gender data network, can serve as an example of other regions and continue to expand and strengthen in the future. I want to reiterate what the Executive Secretary says, that ECA will continue to support the work that the network working with other collaborative partners in this work. I thank you.
Thanks so much, Oliver. Emily, over to you.
Thanks, Kelly, and thank you, Oliver. Thank you to the Executive Secretary for joining us, and thank you to all of our partners at the UNECA and Open Data Watch for co-hosting this event with us. We're also very pleased to welcome a dynamic group of guest speakers and panelists who you will meet shortly. I'm really looking forward to that discussion. My name, for those of you I have not had the chance to meet, my name is Emily Corey-Pryor, and I'm the Executive Director of Data2X. We are a technical and advocacy platform housed at the United Nations Foundation. And our job and our mission is to build the case and mobilize action for gender data, as well as pursue direct interventions to strengthen both the production and the use of gender data. I just want to reflect for a moment also at the top about one of the comments that the Executive Secretary Vera Songwe made that I feel like we need to, I don't know, put on a t-shirt or something, but she said, she said, quote, "Let there be no more doubt that gender statistics are central to our decision-making." And I think that's a tremendous comment. And I hope that every leader of multilateral and international agencies, not to mention some heads of state and heads of ministries, could really take that on and live that. I think that we would make quite a lot of progress in the various challenges we're facing today. One of the efforts that Data2X is pursuing as we think about gender statistics and gender data is really that one of the priorities and one of the essential things to do is to build capacity. We all know that if we're going to invest in gender data's future, we have to invest in the people with the expertise to guide gender data production and use. And filling gender data gaps is more than a technical or an organizational challenge. Changing these types of systems will also require time and sustained investment to build networks among those who work on gender data. I think that with the collective efforts of partners, a network can create connections and facilitate the exchange of ideas and solutions, and ultimately strengthen capacity in all countries. So that's why, as Oliver was just describing, that's why in early 2019, we joined forces with the African Center for Statistics at UNECA and Open Data Watch to form the Africa Gender Data Network. As Oliver outlined, the network brings together gender data focal points from national statistical systems in 15 countries across sub-Saharan Africa to address common barriers and share innovative solutions. In convening this network, we seek to strengthen collaborative relationships among countries. We work to elevate gender statistics and gender focal points within national statistics offices, and to accelerate the uptake of new methodologies to close gender data gaps. We're delighted to be celebrating just over a year of network operations. The year has not gone quite as any of us intended, but we also look forward to strengthening and expanding the group to other interested countries in the future. As we all know, the challenges faced by the global community today are numerous, particularly within the context of COVID-19. And so the need to build partnerships and solve problems collectively is greater than ever. As our recent research has demonstrated, we also all know that the pandemic is not gender blind, and yet our knowledge of the varied ways that it affects different demographic groups is incomplete due to gender data gaps across economic, social, education, and health dimensions. Now, while I absolutely agree with the Executive Secretary that we need to be using data that we do have, absolutely, we also need to acknowledge that there are still some pretty glaring gaps in the data that we have. And that gaps can mean a few things. Gaps can mean gaps in production of data. Gaps can mean gaps in sharing of data, right? So we've seen with Global Health 50/50 and others that sometimes there's cases where perhaps the data is being collected, but it's not being reported, and that's very important. There can also be gaps between whether or not the data exists and whether or not that data is being used. There are many different forms, I think, that gaps can take in the context of gender data, and we have to stay vigilant on all of those things if we're going to ensure that we have the information that we need for better policymaking. We did, and I think you might hear more about this, but the Gender Data Network and the African Conference of Statistics did a survey recently. And one of the things that that survey revealed is that African national statistics offices are facing significant capacity challenges at this moment, which is making it very difficult to respond to demand for real-time gender data to inform pandemic response measures. So against the backdrop of these pressing issues, just yesterday, we actually convened a private session of the network members. This is something that we do from time to time. The point of a network is to bring people together and to discuss common challenges and to brainstorm solutions. And so we did just that. And in this session, we discussed how the COVID-19 pandemic has increased the need for gender data while at the same time limiting many data collection efforts. And despite these challenging circumstances, I'm happy to report that the network members are really finding innovative ways to continue their work. They're complementing traditional surveys with administrative and digital data. They're using combinations of internet, phones, and even app developments to collect data. And most critically, they are building partnerships, both with ministries and agencies within countries and with technical experts, UN bodies, and other international organizations. Gender statisticians are accustomed to operating in a deficit. That is not how it should be, but it is how it is, and you will not keep these people down. So I'm really, really proud of everything that this network has been doing. The tools that this emergency is forcing us to sharpen will apply beyond this emergency. And so we agreed that in 2021, the network will focus activities for shared learning and exchange on post-COVID recovery. We also agreed that this moment of increased demand for gender data underscores the importance of building relationships between data producers and data users. It's something that all of us in the data field have been talking about for a long time, but perhaps this is the push that we need to really get over the line on that. NSOs are responding to policymakers' evolving needs, and we all need to focus on how we keep those communication lines open over the long term. Perhaps most of us listening to this call don't need to be convinced of the importance of international cooperation and partnership, but the global shock of the COVID-19 crisis and the interlocking health, economic, and security crises that we are all facing collectively are affecting us differently and will require trust and partnership to navigate. I'm looking forward to hearing from all of our colleagues today who I think will further demonstrate the necessity of partnerships for ensuring that data drive responses to the problems that we're all facing. I urge governments and international organizations and all of you here on this call to recognize and to push for the importance of gender data, both during and after the pandemic. It doesn't go away. The importance of it does not go away once we kick this situation that we're in. And we all need to take steps to ensure that quality sex disaggregated data is financed, collected, reported, and made available and useful to the data users who are making decisions. We are so pleased to continue our support for the Africa Gender Data Network, and we are grateful to all of the gender data focal points within NSOs who champion innovative solutions. You all are tireless and fierce, and that is the only way we are going to ensure that the data picture does not stay blurry, that it comes into focus, and we can understand truly how to build better data-driven policies for a more gender equal world. Thanks, Kelly. I'll turn it back over to you.
Very well said by Vera, Oliver, and by Emily. I think you've all done such a great job of setting the scene and really emphasizing the importance and the potential of partnerships. And so with that, let's turn to the panel portion of the event. And right before I introduce our panelists to you, I'd love to turn to our audience, actually, and get a sense of your thoughts on the power of partnerships and the important ingredients for partnerships. So if I could just have my colleagues, oh, all right. So the poll is up. Hopefully you can see that. So the question is, what is the most important ingredient for a successful data partnership? And your options are bring together all relevant actors, involve all partners in the decision-making process, partners have a high degree of identification with their partnership, a stable framework with a certain degree of flexibility to allow for all the necessary changes and adaptations, and strong communication among the partners. So I'll give you just a moment to answer that poll question. And in the meantime, hopefully I can have our panelists start to join me on the screen. And I know we all wish that we could be spending more time in person these days, but there is something very dramatic about having our panelists pop up on the screen for you. All right, so with us today, we're so lucky to have Mercy Kanyuka, who is a Commissioner of Statistics at the Malawi National Statistical Office. We have Johannes Uting, who is the Executive Head of Paris 21. We have Jessamine Encarnacion, Policy Specialist at UN Women. Norma Altschuler is with us, who is Program Officer for the Hewlett Foundation, as well as Catherine Hay, who is the Deputy Director at the Gates Foundation. So very, very happy to have you all with us today. And before we dive into our discussion, let's see what our audience had to say about what they think makes a strong partnership. All right, so I think we had votes across the board, which makes sense because these are all important pieces of a partnership, but strong communication among the partners came out on top. And so I'm sure actually that is something that many of our panelists will get into today in terms of what makes a successful partnership. But let's kick off our discussion with a question for all of you, because you all come from across the gender data ecosystem. You all bring a really unique vantage point. So let's pose this question. Can you share what are the top 2 things your organization is doing to respond to COVID-19 and the pressing need for gender data? So just the top 2 things that your organization is doing right now. And Mercy, if we could start with you, and I would ask all panelists to hopefully keep their comments to under 2 minutes.
Thank you. Good morning, good afternoon, and good evening to everyone. Once again, let me introduce myself. I'm Mercy Kanyuka, Commissioner of National Statistical Office in Malawi. And to respond to COVID-19, as the National Statistical Office, we've had to redesign some of our surveys. We are actually conducting a high-frequency survey, which we are using mobile phones to households, a sample for households, to find out the impact of COVID-19. So we've had to redesign. At the same time, we've had to also introduce some precautionary measures to our field teams in our major surveys. So we, instead of just sending them out, we are now procuring and making sure that they have sanitizers, they have masks, they have, so it's extra expense, obviously, but we are taking care of that. And these masks are not just for them, even for the respondents. We're buying masks for the enumerator as well as the respondents. So 2 things, those are the 2 things. Thank you.
Thanks so much, Mercy. Norma, what are your thoughts on this?
Thanks, Kelly. At the Hewlett Foundation, a large part of our response is around you taking the data that we already have or data that can be generated quite quickly and trying to position that to inform COVID response. So one of the ways we're doing this is by working with multilaterals. We all know that multilaterals are spending billions of dollars on response in health, education, social protection. And we also know that there is some funding available for data work from multilaterals, not as much as we'd like, but substantial amounts of money. So we asked ourselves, can we take this money and make it just a bit more gender sensitive? So we're supporting gender champions in a number of institutions, including the World Bank, who are already working closely with government counterparts in NSOs and in line ministries. With our modest support, they can do a little more to gather and analyze data on COVID's effects by genders and on gender-sensitive solutions. So a quick example, governments around the world are really struggling with what do we do with scarce social protection dollars at times when we need them more than ever. We are supporting things like what targeting methods reach women and what targeting methods leave them behind. What new targeting methods might be most helpful in the context of the new needs of the pandemic, and how can we make sure they're gender sensitive. Second, and quite complementary, is supporting on-the-ground research organizations that are supporting governments. Lots of issues that multilaterals aren't well positioned to consider. And so we find that having a little bit of an external support for as a partner, as governments are struggling with issues like how do we continue maternal health services in this time, we're hoping will be quite helpful in terms of gender sensitive response. So the common theme here is we look at where there are existing pots of money for COVID response, existing partners working with governments to use data to inform decision making, and to provide a little bit of extra resources to make that work extra gender sensitive.
Thanks so much, Norma. Catherine, let's go to you.
Thank you, Kelly, and thanks to the organizers of the session. The Bill and Melinda Gates Foundation is working on so many aspects of the pandemic that it would be really hard for me to choose. We are working on vaccines, we have colleagues working on therapeutics, we've got kind of massive modeling efforts going on, including in multiple countries. So I'd really struggle to pick the top two ways that the foundation and my colleagues are contributing. It's a pretty cross-foundation effort across multiple fronts: health, economic, other. But I'm going to just give instead two early examples of how we responded and jumped in with partners on some of the gender data gaps in particular. So as we all know, the pandemic crosses health, social, and economic sectors. And these are all areas that our foundation works on and has been trying to work to close gender gaps in these spaces for some time. And the gender data gaps in particular, I would say we've been championing and investing in for about 5 years. But the pandemic really just, I think, has added urgency to this. And for all of us working in this space has sort of shown the reason why closing these gender gaps is so critical. So in March, we saw one of the first things, one of my two examples. In March, we saw that the lack of sex disaggregated data was hindering an understanding of biological, social, and economic determinants of the COVID-19 disease burden for men and women. So we were working with partners who were modeling the disease, and they were struggling with the absence of sex disaggregated data. And we know that this data is just essential for more targeted and effective response. So we communicated actually with Sarah Hawkes and her team at the University College London, who are working with a team of volunteers because we saw their tracker. They had a sex disaggregated tracker, and we saw that they were rapidly collating and reporting government data in that tracker. So we didn't come up with this idea. We saw what they were doing. We talked to Sarah, we saw that they were struggling and doing this sort of on a voluntary basis, and we thought this was valuable, and we jumped on board just to try to support and help them keep doing what they were doing. And I think that support has helped them continue their work and take it forward in more depth in some countries, including India and Kenya. To give another early example, we also saw that this disaggregation of primary health data, while critical, just wasn't enough. We knew that the world was going to need data on all aspects of women's lives being affected by the pandemic. Many of the kinds of things that were already not being really very well measured in many countries, such as unpaid care work, informal employment, social protection coverage, gender-based violence. So again, I think similar to Norma, we couldn't close these gaps ourselves. But in order to support researchers, survey owners, and others who were trying to collect data on how COVID-19 is affecting women, my colleague Diva Dar worked with our partners at the University of California in San Diego, led by Anita Raj, to leverage their eMERGE platform. And that team rapidly developed 16 survey modules, making it easier for groups who were doing survey work, who were rolling out rapid surveys, to try and incorporate these gender modules into these multi-country and country-specific surveys. And the two elements, or the element that I'll flag in these two examples, was really, I think, where philanthropic capital can play a role. One, sort of seeing gaps that need to be filled, seeing good work that's happening that needs some support, and trying to jump in and leverage and work with existing and new partners to try to close some of those gaps.
Great. Thanks so much, Catherine. Johannes, could I have you share your thoughts?
Thank you very much. Good morning, good afternoon. Greetings from Paris. So Paris 21, as you may know, our mission is to support national statistical offices and to help them in strengthening national schemes to support the production of data and statistics that matter to people. And of course, the COVID-19 crisis, as we just heard from Mercy, has affected national statistical offices all over the world, and in particular in low-income countries and in vulnerable states. Our business model was also affected because usually we would travel, we would provide technical support on the field. So we had from one day to the other also to change our business model and to adjust. I think one thing very concretely what we did is to try to understand better how deeply national statistical offices are actually affected and to really understand the different impacts that we can observe. One impact is, as Mercy mentioned, on the production side. I mean, not being able to do any survey is a sort of a great barrier to produce data that matters to the policymakers. But also on the dissemination side, we did an analysis about tweeting from national statistical offices, and you could see, quite interestingly, some offices were actively communicating and disseminating statistics on COVID and related to COVID, and some others not. And we are trying to bring this evidence and these analytics in discussion to our colleagues and friends of the statistical offices. So the good thing is, while it was challenging, we kept the dialogue, and we use now webinars and all these kind of things, virtual meetings with them to continue the dialogue and to help them in this very difficult situation. Let me give you one concrete example, and I'm glad that Jessa is also there from UN Women, because it's part of the Women Count project that we are happily doing together with UN Women from El Salvador. The UN Women Count project, basically the idea is to mainstream gender statistics into the national policy planning. So countries have a national policy plan and they have statistical plans, and the idea was to mainstream. Now, when the COVID hit El Salvador, there was no interest for the classical NSDS anymore. I mean, there were other priorities. And the government came to the statistical office and said, hey, we need specific data and we are interested in gender specific data. Can you help us to have a COVID gender data policy and data that can help us to provide the response that we also just heard earlier on from the speakers who spoke before. So in that sense, we needed to adjust, but it was a happy adjustment in that sense, because it replied directly to a need expressed by the countries, and to make the COVID response, the COVID data response of El Salvador more gender friendly in that sense. So it has to do with data gaps, it has to do with capacity gaps. And that's a very concrete example of how we could help countries, or how we can help countries to, even in this difficult period, to eventually even change for the better. A second, very quickly, is luckily we are anyway keeping up, changing our business model. And we just were about to launch our Paris 21 Academy, which was planned for a long time ago. It's an online learning platform where we launched a gender module. It's also part of the UN Women Count project. And that came quite handy at the same time. So we accelerated this. We will be launching new models, and we were quite happy to see that there was quite an uptake. So let me conclude by saying it's a big challenge, and we are in daily conversations. Yesterday I was talking to the Zambia Statistical Office about environmental statistics, but people are also really interested. They are really interested, they are committed. And so it's also an opportunity, I have to say. Thank you.
Thanks so much, Johannes. And last but not least, Jessa.
Yeah, good morning, good afternoon, and good evening, everyone. And thank you, Kelly, for the question. So if you will allow me to instead name the top 3 that we are doing, I would like to say, 1, the conduct of COVID-19 rapid gender assessments, which we started in March, and we have completed so far almost 40, and we have like at least 30 planned and ongoing, particularly mostly in Africa region. And then second, the global gender response tracker, which captures at least more than 2,500 government policies and measures, and we checked whether these are gender responsive policies and measures. And then lastly, the new poverty estimates or forecasts, which show that the pandemic will push 47 million women and girls into extreme poverty by 2021. And what I must say is really what made this possible is really the power of partnerships. So for example, in the rapid gender assessments, I mean, working with at least 70 countries from national partners, UN agencies, etc., we are able to tap on coordination mechanisms that have been institutionalized even prior to COVID-19. And these were supported earlier by the Women Count program. So this created that enabling environment wherein users and producers can immediately discuss and plan and conduct the rapid gender assessment. So this facilitated the consultations, so that immediately after the conduct of the surveys, there's immediate link between the data production and the use. And likewise, it also provided an opportunity for us, UN Women, to tap on other actors in the broader gender data ecosystem. For example, the private sector, particularly the mobile phone companies who supported us in this data collection activity. And on the other hand, in terms of the global policy tracker, as well as the global poverty estimates, we also tapped on long-standing institutional partnerships with UNDP, and likewise tapped on new partnerships with academia. So as a result, we do not only have the much needed gender data during the crisis, but equally important, demonstrated use cases where we see the survey results used in the formulation of integrated policy responses for COVID-19 as well as mitigation strategies. And a specific example for that is Maldives, wherein they have extended the income support allowance for those self-employed as well as those in the informal sector due to the results of the survey. Thank you, Kelly.
Thanks so much, Jessa. And to all of our panelists, I think you've all done a great job of setting the scene in terms of the immense challenges that the pandemic is posing to national statistical offices, but also just to gender data collection writ large, but also the opportunities, because what I'm hearing is that this is potentially accelerating partnerships. And so that's exciting to hear. And I'd love to get a bit deeper into all of your experiences and perspectives, and ask kind of a tailored question to each of you. If you could try to keep your remarks under 5 minutes. I know it's difficult, but we'll give it a shot, just to try and keep space for Q&A. I know our audience is anxious to ask their own questions. But Jessa, I'm actually going to go straight back to you. You know, 2020 was supposed to be a really momentous year for women's rights. Mm-hmm. But COVID, of course, has caused a regression in gender equality. And you've mm-hmm. mentioned this, and, you know, we've seen this in the rapid gender assessments and things that UN Women has done. I mean, where has progress been interrupted by COVID-19, would you say, particularly when it comes to the production and use of gender data? And what support can agencies like UN Women provide to fill the gap?
So yeah, thank you, Kelly. So on the progress interrupted by COVID-19, so before I directly respond to that question, it is important first to recognize the progress that has been made so far, that today more countries have reached gender parity. For example, in educational attainment, literacy rates have improved, fewer women are dying in childbirth, and the global maternal mortality ratio has declined. Social protection has likewise been strengthened, and we see more countries have bolstered parental leaves. And for the past decade, around 131 countries have passed laws to support women's equality on access to healthcare, education, political participation, and representation. So, however, in too many areas, progress have been painfully slow. Less than 2/3 of women are in the labor force as compared to more than 90% of men. And this is the same figure that we see 30 years ago. And 243 million women are victims of intimate partner violence each year. 190 million women still lack the means to avoid pregnancy, even if they want to. And globally, 75% of legislators are men. So it's, at this point, it is important to stress that prior to the pandemic, we only had 31% of the data needed to monitor the gender-specific indicators and the SDGs. So obviously, we have severe gender data gaps, and the pandemic has exposed the vulnerabilities of, as well as the fragile gains that threatening the fragile gains that we have on gender equality and women's rights. So as to directly respond on to your second question on the support that UN Women can provide to fill the gap. So we at UN Women, we continue to work with national statistical systems to positively change the way that they do work on gender statistics. So meaning it's not merely data production centric, but rather, which is often a one-off activity, but rather focusing on developing capacities of the system so that they can produce as well as use the statistics in a sustained manner, not just just because we conducted the survey or supported the survey, they are able to do that. So that model of UN Women support places national gender data systems in a state of preparedness to some extent as coordination mechanisms are in place. So a few cases to cite, for example, in Kenya, the establishment of Gender Statistics Committee brought new players and more inclusive data. So having non-state actors, academia, research organizations, and even private sector and the media partners advanced conversation that has not been prioritized before. And this, for example, specifically led to a joint baseline study on women's access to agricultural finance. And as a result, the Agricultural Finance Corporation revised its gender policy and financial commitments, allotting 10 million US dollars to address identified gaps in women's financing for agriculture. Another example that I can cite is really Violence Against Women survey in Morocco, wherein the NSO incorporated listeners from CSOs who are providing service to victims of violence. So the CSOs, having worked together with the NSOs during the data collection process, they now know more about the data, they now trust the data more, and consequently, they now use the data more. So as a result, some CSOs are actually already using the preliminary results of these surveys to call for changes in the in the law combating vow, and likewise working with state bodies to do so. And the last example for on this is really Maldives. We don't have a full women count program project in Maldives, but partnering with Paris 21, now they're working on integrating gender in their NSDS. So when we did a rapid gender assessment survey earlier this year, it was relatively easy for us to engage with the NSO and the Ministry of Women because of earlier coordination and partnerships that was established when they were discussing the national strategies for the development of statistics. So, so as a result, these two key players for gender data production and use has been engaged and has been part from stage zero to the design to advocating for higher response rate and more importantly on terms of the use of the statistics. So I already mentioned earlier the actual use that we have seen in Maldives, and likewise the Office of the President has in fact used the survey results from gender surveys to in their COVID-19 recovery team. And I think in terms of major shifts towards the support that we would like to do, World Bank and UNSD and the UN Statistics Division has so far done 2 survey rounds of how NSOs are heavily impacted by the crisis. And the results provide useful information for the global statistical community, in particular the UN system, to ensure strategic decisions are made. And it is thus more critical than ever to start supporting these countries based on their expressed needs, demands, and challenges. And just to end this major shifts in support, I think in the national context, just want to end with the example from Cameroon through the Women Count program, wherein a high-level interministerial committee on gender statistics has been created, wherein both the NSO as data producer and the Ministry of Women as the data user are co-chairing this committee. And it served, that committee served as building blocks for system-wide coordination, and it advanced the leadership of these two key players in the development of gender statistics. So as a result of these partnerships, the government has invested a total of $700,000 on gender statistics, $300,000 this year and $400,000 next year to the Ministry of Women. And these are major shifts not only on the way we do partnerships, but also major shifts on how government is appreciating the value of investing on gender data and information. And ending on that happy note, I turn over to you, Kelly.
Thanks so much, Jessa. It's great to have those concrete examples of where partnerships can really take us in terms of gender data. And also Jessa and Johannes helped me immensely on a story I recently wrote on financing gender data. So a belated thank you to both of you. But now let's go to Mercy, because in many of these instances, we're talking about partnerships across organizations and across agencies. But given your unique perspective coming from within a national statistical office, I'd like to get your take on the power of partnerships within the national statistical system. And so as your office responds to the demands of COVID, what have you found to be the most effective for coordinating response efforts across multiple agencies and departments?
Thank you for that question. Indeed, there have been many players in the field of statistics before COVID-19 and more so now, because the demand for data is there. So National Statistical Office, the Malawi National Statistical Office operates a common service where we've got statisticians in mainline ministries. So for example, in Ministry of Health, we do have statisticians who technically, the National Statistical Office is responsible for their supervision and responsible for their work. So the ministry is disseminating COVID statistics, COVID figures, infections, where they are, and deaths and so on a regular basis every day. And the National Statistical Office, through the officers, the statisticians in the ministries, are working on our behalf, so they are able to do it. But I must also mention that we do have a UNDP coordinated hotspot project, where we are looking at GBV, gender-based violence statistics, from institutions like the police, prisons, hospitals, health facilities, and we are planning to integrate all this data in a data hub to be housed in National Statistical Office. And it's a project, it's a 3-year project to be rolled out to, currently we are going to just cover about half of the country, but it will be rolled out later to the rest of the country. And this is, there's been a lot of coordination around this initiative, and it's quite positive. We're looking forward to seeing these results of GBV in that area. So there has been coordination through the National Statistical System Steering Committee, which we have. We have been coordinating the various line ministries who are producing official statistics. At the same time, whenever National Statistical Office is conducting its surveys, we do bring in the UN Women, we do bring in ministries and other agencies, and even the researchers to come and to have an input in the data collection tool, and then even during the analysis. I'll give an example. We conducted the population housing census in 2018, and we have developed a gender thematic report. We have analyzed the data further and come up with a gender thematic report. And that report, we involved stakeholders from the Ministry of Gender, from the CSOs, from the UN Women, and to come and tease out the data and be able to come up with a report where we are also looking at policy implications, and that's part of the report. That report, as well as other thematic reports, are to be released, launched next week on the 23rd. So we have been coordinating a lot around gender statistics, just like also one more item where the COVID-19 disturbed us for a period of 2 months. They disturbed the field work. We were collecting information on mixed multiple indicator cluster survey. So we had to break for 3 weeks. But now we finally went back with the precautionary measures I mentioned, and we were able to collect. And after the mixed report, we are going to come up with another gender thematic report as well. So we have been coordinating a lot, and the power of coordination has helped us to sensitize the whole office on gender issues, so that we can come up with gender specific and sensitive reports. Thank you.
Thanks so much, Mercy, for kind of taking us inside what's going on in your National Statistical Office. That's really interesting. Johannes, let's go to you. So Paris 21, I know, works really closely with the Burn Network to advocate for more and better financing for development data. And in a recent UN Stats study, about half of the statistics offices in low and middle income countries reported a funding decrease because of the outbreak. And this is something that many of our speakers have mentioned already. So how do we use this unique time, which you did describe as, you know, potentially an opportunity, with increased demand for data, to really raise the profile of gender data and advocate for more funding for NSOs in particular?
Well, thank you so much, Kelly, for this great question. But before maybe talking about the opportunity, maybe we can just pause a second and be very clear about the challenge. I mean, I had the opportunity now to work since 10 years with Paris 21. I'm a development economist. I've worked on other sectors. And I have to say, mobilizing money from donors as well as from planning ministries and financing ministries for data in general is a huge ask and a huge task. And I have my little own experiences talking to mainly bilateral donors. We are hosted at the OECD, so I have, you know, direct access to the DAC people. And I can tell you, and they are very open about this. There are many different reasons why it's very difficult for a DAC donor to invest in data and statistics. And if you see the numbers, together with partners, we produce the so-called press report each year. And over the last 10 years is less than 1% of ODA given to data and statistics. And that's it. And the only part where we have seen an increase, and this is thanks also to Hewlett and Gates, was in the last couple of years for gender statistics. There are some other parts. In a couple of years, we see a little bit of an upswing, but overall, it's a heavy ask. And it's often more sexy to open a hospital, to open schools, than to say, hey, I invested in the statistical office in a given country. And what is the imminent answer? More and better data is only a mean to an end, to a better policy for better life. So I just wanted to say this with all the excitement I have for the eventual opportunity. Now, opportunity. I think it's useful to reflect a little bit more what increased demand really means. I think for the data and statistical world, this COVID beast is tricky. Yeah? On the one hand, we have more demand for data, that's for sure. And even in our own families, we now talk about infection rates and R values and get excited. And even most of the governments would say, hey, give me the data so we can do informed policy making and you know, do efficient policy. So that's very good. On the other hand, though, we have seen lots of data gaps, and policymakers are very impatient, and they say, hey, statistical office, where's that data? Administrative systems, where's that data? And then we see private sector companies coming in, putting all sorts of data out where hardly anybody can know the quality. I'm not saying per se bad quality, I'm just saying we don't know. And policymakers will not necessarily make the distinction between high quality and low quality data. So we have a bit of a cacophony as well. And people get increasingly confused about making sense of all that data and that evidence, because you have 3 different professors talking to you and saying 6 different things. So what does that mean? It means that on the one hand, there is an appetite for a better understanding for all these things. There's an appetite and a chance to make clear to the broader informed public that quality data, I'm not saying official statistics, that quality data is important, and that it makes sense to invest in such a thing. It's like a public good that we need to invest to, like in military infrastructure, good health, whatever. It's a public good. So if we can bring this argument across, and we have here a couple of people who can help with that, that would be great. The other point is, the opportunity I see is, in particular now talking about gender data, is that many people would say, okay, let's invest at least in health data. Let's focus on health. It's all about health. Well, I mean, as we now know, and I was glad the examples that were mentioned before, for designing recovery policies and efficient social protection policies, you would need to have data from many other sectors, not only health, from employment, from labor markets, from agriculture, from infrastructure, from sewage, from you name it, governance, and so on and so forth. So it's a system question. It's not a silo question. I think the other big ask we have to use is opportunity is to ask for more and better investment in systems, which is critical. And I think we can use this crisis to say we need to invest in trusted foundational data systems that can produce the data, in particular then also on the topic we are talking about gender data. Now, the last point, and I close with this, is excitement about a partnership which is called the Burn Network. It's an informal partnership. It's a partnership of statisticians and development people from all over the world, from international organizations to bilateral donors to national statistical offices to lobby groups. It's a really great partnership, and some of Open Data Watch and UN and World Bank and a couple of colleagues here on the call are part of it. It's really exciting. I think the next to putting out a couple of interesting papers, among the questions, do we need a global fund for data? The Burn Network is about to launch a sort of clearinghouse. And I wanted to end on this note because the clearinghouse will be launched, I mean, not the clearinghouse per se, but the idea in 1 week's time, next Wednesday, so at the UN World Data Forum. And some of the colleagues will be speaking there. But the main idea is, what I learned is from donors who say, yeah, more money is, tell me first about better money. And I think we have still an opportunity, even within the given resources, to do much better and to help to spend the resources better. And one key question about spending better is to have more access to information, how funding flows are currently. There are, on the supply side, there are some data management platforms. The OECD has the DAC codes and so on and so forth. We have some good ideas, but it's not granular enough. It's not granular enough, and it's particularly not matched with the demand side. And if you talk to people like Mercy and to many other chief statisticians in this world, but you will see, and we did a survey, they are quite unsure, even themselves, how to advise a national planning ministry where exactly to invest. Because the information about where to invest, is it in CRVS? Is it in ID systems? Is it in a household survey? Is it in a census? This is all highly relevant. And we have good data out there. I would concur with what has been said before, but it's not necessarily all transparent. It's not necessarily easily accessible. And this clearinghouse hopefully will provide an opportunity to bring better the supply and the demand side, which then, if donors then are convinced, hopefully also raises more and better funding. So this is an exciting partnership. And with this positive note, as Jessa, I also wanted to end on a positive note. Despite all the challenges, you know, we have to be optimistic, and we definitely the interest and the awareness is definitely increasing. Thank you very much, Kelly.
Thanks, Johannes. Thanks for walking us through the intricacies of more and better funding. I know we could talk much further about that, but first let's go to Norma. So Norma, I know that the Hewlett Foundation has been vocal about kind of moving the discussion up the data value chain. And so focusing not just on production, but on data use and impact. So how do networks like the Africa Gender Data Network, would you say, increase the value, use, and trust of data? And can partnerships like these yield substantial results?
Thanks, Kelly. At Hewlett, we've supported frankly, dozens of networks over the years. And I'll be honest, some have had huge success and others have been disappointing. So what's the difference and why am I optimistic about the Africa Gender Data Network? Well, there's a couple levers that we've seen networks push in the past and that I think that this network has an opportunity around. One is solidarity and support that's a foundation for action. So I think if you're a part of this webinar, you probably know that being a gender champion can be really lonely. And the individuals who I've had the opportunity to hear speak and connect to in this network are such inspiring individuals. I found, and I'm sure many of us have also experienced, that colleagues who affirm a sense of purpose and who make traction in really difficult contexts where gender data is an uphill battle can spark not only solidarity, but also specific ideas and actions. So that gets into the second lever I've seen networks pull on, which is learning. Some of this is around peer learning, including inspiration around idea, and some of this around particular new methodological innovations, and some of this is around targeted skill building. So coming back to your question about data use, Kelly, I've been really excited to see that what a lot of the network members are asking for is that last mile of the data value chain. Communication, dissemination, analysis, relationship building, the kind of inter-ministerial navigating that Mercy alluded to. And so I'm optimistic that both from learning from peers and from targeted support from outsiders, there can be an opportunity to support these gender data champions in being even stronger usage champions. Third, and I would say especially close to my heart, is joint solutions. Many of these countries are grappling with common challenges. And so one of the things that Mercy touched on that I know is coming up in many other countries is culturally sensitive ways to measure gender-based violence and ultimately to be able to track and use statistics bringing together different data sources. I'm optimistic that the network will be a powerful platform for people who are closer to the ground to develop common methods or just complementary approaches that may need to be adapted in different countries, as well as to develop common approaches to these softer challenges around relationship building. And finally, and perhaps most importantly, is political inspiration and ultimately political will. As Johanna said, it is hard to convince people to invest in data. It's hard to convince bilaterals and multilaterals, and it's also hard to convince people in country. We've seen other networks play a role in gathering political will. So indulge me in an example. Evaluations. What governments want to pay to evaluate programs, taking money away from things that are more closer to the ground of what their constituents are asking for, when those evaluations will, at least in some cases, show that program results are probably disappointing? Well, we've seen in the past that networks and peer learning can play a role in sparking governments to invest in evaluation. For example, South Africa visited Mexico, had support, both inspiration from the Mexican Evaluation Office, CONEVAL, but also just political support in terms of peers and colleagues who are giving friendly nudge, providing some soft incentives, which led South Africa to set up a formal evaluation office that directly reported results to cabinet. From there, many other, about half a dozen African countries, inspired by each other and by South Africa, set up evaluation offices. And here again, a peer, somebody who was political, who had been inspired by an evaluation champion, was critical in terms of setting the example, in terms of a little bit of peer incentives, and in terms of support. So coming back to this network, I'm hopeful that as some of these countries begin to get traction around gender data, begin to demonstrate that gender data can be used to solve problems and get political support, that will unlock support from other peer countries as political leaders come in and are willing to put in a good word about the power of gender data elsewhere.
Thanks so much, Norma. That was really helpful to have you walk us through networks in particular. I appreciated that. So Catherine, let's go to you now, last but certainly not least. I'd love to get your take on just the fact that in many countries, COVID-19 has increased demand for quality and timely data, as we've heard throughout this session. So what role can donors play, would you say, in making existing gender data accessible, promoting the opening, sharing, and use of gender data, and highlighting the ongoing need for data-driven decision-making?
Thanks, Kelly. One of the challenges of going last is I know I'm standing between us and some questions from the audience. So I will try to go quickly. One of the advantages of going last is that many of the other presenters have touched upon a lot of the points in these questions. So that will help me, I think, do so. But excuse me if I'm skimming over some of the components of your questions so we can get to the audience segment. So taking a few of the pieces of your questions, let me take the what role can donors play in making data accessible first. At minimum, and this is the bare minimum, but we're not always doing it, I think we need to ensure that any data collection we are funding becomes a public good, and that that data is shared and made public and is publicly available. We need to build those conditions into our grant agreements and arrangements, and we don't always do this. Or we have such long timelines that by the time the data is released, it's no longer as useful or relevant as it could have been. But access is much more than just making data available somewhere in a repository. We need to be active in working with our partners to address access gaps, in making that data more usable, and providing support to key users to engage with that data. Because just because data is available in theory, and it's often not even available, but just because it is available somewhere doesn't mean that it's easy to access. So I think as donors, we need to encourage that access by looking at the barriers to access. So what's holding people back from accessing and using that data, and trying to dismantle those barriers, and whether those are barriers of information, technology, or capacity. On the part of your question on supporting quality and timely data, I think this actually raises real challenges for many donors. And I think Johan kind of alluded to this. So a lot of times donors want to be able to capture immediate issues and impact, or understand whether their funding, our funding, is leading to real change on the ground. Because of sort of the gaps in country systems often, or weaknesses of those data systems, that can create incentives for donors to invest in parallel survey and data work outside of national systems. And sometimes that's important. For example, right now with COVID-19, we're supporting rapid surveys, often done by private survey firms, as Johan said, where we need rapid data now. For example, supporting the UN Women, rapid gender assessments, and several other partners as well who are rolling out rapid gender assessments in multiple countries. And this is important work. It's providing some of the first findings showing women experiencing more adverse effects than men, especially in poorer countries. But it's also important to work to strengthen the ability of countries to produce their own data. And so often there is a trade-off here and a tension, because I mean there are limited funds. So I think donors have to really think about balancing that kind of parallel survey and investment in those types of exercises to get quality data quickly, relative to investing and supporting country systems, that longer term play, to be able to generate and use data in a long-term sustainable way. So when we're investing, I think we really need to ask whether our investments can support or amplify or use the work of national statistical offices, civil registration vital statistics systems, health surveillance, and existing administrative data systems. And at minimum, we need to consider whether our investments don't undermine those systems by taking away resources, and whether people, that's a critical resource, or funding that would otherwise be going into those systems. We know one of the massive problems is that these systems are really underfunded. And even prior to the COVID-19 pandemic, there were significant gender data gaps due to budget gaps overall in investments in these systems. And that's not going to go away. If anything, we're going to see less fiscal space going forward to support so many critical areas of work, including data work. With the rapid spread of COVID-19 pandemic, we're already seeing and hearing that statistical offices are reporting a reduced ability to meet international reporting requirements. Some are already experiencing budget cuts, and that too in a period where data collection is going to get more complex, more difficult. So I think we can expect that we're going to see actually exacerbating data gaps. And now you're asking me to speak in terms of donors or funders, and obviously this is not something that funders can address alone. Foundations like us at the Bill and Melinda Gates Foundation, bilateral donors, multilaterals, all need to be exploring how we can support and partner with country partners and country governments to strengthen national data systems. Finally, to take the question, I'm going to sort of bundle your last two questions around spurring and encouraging use. Because I think part of the answer to that question, how do we spur use, is sort of the other part of your question around how do we have data-informed decision making. Investing in data systems is often an investment in the future, given the time needed to collect, clean, analyze, and use data. So to me, creating that energy and elevating the need for countries to invest in their data systems when they have so many other things to invest in isn't easy, and you have to demonstrate the use case again and again. And here I would point to the work of groups like Data2X and data journalists who are popularizing data, making it accessible, reinforcing why this investment matters. But I think increasing use just also increases the value that everyone can place on data and their likelihood of supporting investments in data systems. So when we get data into the hands of advocates, they become data champions. When elected officials are able to use data to target efforts in their constituencies and show change to voters, they become data supporters. When evaluators use data to demonstrate the impact of different government programs, ideally, as Norma said, ideally showing that they've worked, but also showing gaps in coverage of critical outcomes, they also can become allies and support data investments. So to me, the funding and investment really has to go hand in hand with the use. I think that's how we build that support, and I think it's really essential in the coming days. Thanks.
Thanks so much, Catherine. We do have a couple of questions coming in, so I want to make sure that we move quickly into Q&A so that we can get these questions to you. And this is actually going to be more difficult than usual as a moderator, because I know that all of you could offer amazing perspective on any of these questions. So if you do have something that you really want to answer, please just do so. But one question is one that Catherine actually already mentioned. And so I wonder if we get someone else on the panel with a slightly different perspective. But it's how to balance the tension between data for now and building the foundational data that takes time. And so Catherine, you kind of mentioned that, you know, from the funding perspective, but how can partnership help with hitting that balance? And I wonder if maybe Jessa or Johannes or Mercy feels well placed to answer that.
Yeah, I can
go for it.
Yeah, okay.
Yeah.
I can go for it. Thank you for the question. And so I think definitely these are two equally important, like, you know, asks, and both we must respond to. And I think these are not mutually exclusive. It's not a choice between one over the other. And then, of course, where to hit that balance. I think what I have mentioned earlier somehow alludes to that in terms of immediately, just for taking, for example, the rapid gender assessments. I think it's basically data for now. It has been, like, you know, responded to the critical data needs as urgently as needed by governments. But likewise, building on the institutional mechanisms, I mean, the kind of enabling environment that we have created earlier facilitated the process. So if probably the foundational system that, you know, that coordination mechanisms that were probably would are not in place, we would have been scrambling on which part, who would be the gender statistics focal points for each of these ministries, who should we be engaging with as far as the data producers as well as data users are concerned. But since, I mean, there's that certain level of engagement, strong engagement, if already from the onset, it facilitated how we are able to respond system-wise. So I think it's both moving in parallel, just making sure that you know, that while you're responding for the data for now, you're not forgetting that when you do that, you do not do it, like, you know, in silo, meaning you're doing it making sure that NSOs and NSS in general are capacitated, so that when a new crisis hits, God forbid, hopefully not, but, you know, they are well prepared and well positioned to still be able to respond to that. And on the other hand, like, you know, building on that kind of existing system, they are able to respond to the immediate crisis. So I think it's making sure that it's building on both strengths rather than choosing between the two.
Thanks, Jessa.
Yeah.
Another question is how have you seen donors coordinate their support to gender statistics during this time? And I wonder, does that jump out to anyone to answer?
Yeah,
Mercy, please.
Yes, thank you. We do have a government instituted COVID-19 steering committee, and it has, I think, development partners are coordinated around that steering committee. I must mention that there are obviously other activities going on where development partners are funding NGOs to carry out studies and so on, which may not fit directly into this steering committee, but there is some sort of coordination. And the UNDP, UN agencies are the ones who are leading, they are the lead agency where government efforts and so on around COVID-19 data gathering are working through. But I must mention that I would have loved to see more coordination, and especially what happens is that an initiative is carried out, and suddenly you see figures in the media about the example of Malawi, talking about 13,000 child marriages have actually taken place within COVID-19. Or they'll tell you of how many women, girls are pregnant during COVID-19 because schools were closed and so on. Now, with that information, the UN would know that NSO, National Statistical Office, has to validate and come up maybe with some modeling, have to validate. But there's this gap because the people who were actually doing this study, who have released those results, did not do it in conjunction with the National Statistical Office. So we don't know the methodology. We don't know whether it is statistically sound. And this is just to also concur with the Johannes, that we cannot validate the information. And some of it, crudely speaking, may not necessarily because of COVID-19. May not, because even in 2018 population housing census, we had 243,000 of the under 20 years of age were married anyway. So it's quite tricky. You really need to involve, they really need to involve National Statistical Office, who are the experts in data collection, right from the beginning of the study to the end, so that we are able to really isolate impact of COVID-19 or impact of other factors, not necessarily COVID-19. Thank you.
Thank you, Mercy.
Can I just come in?
Yes, please. I actually have
now, if I may just follow up on
please.
Catherine's and Mercy's about this possible trade-off between investing in short-term quick surveys versus long-term investment in systems. I think this is a key question which is really relevant for this conversation and for producing gender statistics. My overall sense is, to be honest, that the balance isn't right. The main point would be, that would be my hypothesis to be debated, but that we don't get the balance right. I mean, now with COVID it's an exceptional situation, but there have been many other exceptional situations before. There was a financial crisis just 10 years ago, and there's always something exceptional. So, which makes us then to underinvest in foundational systems, which we will pay off in the next crisis. Why do some countries are able, and of course you can say because they are rich. I mean, the Nordic countries, they have very strong administrative systems. They press on the button and they have the data. There's no need to do long surveys running around, press the button, get the data. Of course, small countries, you can't compare to a big country like many in Africa with many more inhabitants and a very different situation. But I think the underlying issue is probably also a misalignment between national priorities and international goal monitoring and what others believe or international community. And here the SDGs are very helpful, but I think we need to make need to be working a bit more closely on, do we produce data for monitoring purposes, international comparison purposes in New York and having fancy books, so we can compare a data point in Uganda with Tanzania, with Germany, with US? Or is not also our objective to produce data that's useful for our national policy making context? So I think the balance here is not right. And now how to get there is a long conversation. One thing is, I think Mercy alluded to, is strengthening I think we also need modernize, revolutionize, change of how national statistical offices work, becoming from a pure data producer to be a data steward. That's what we would currently say, data stewardship certifier. It doesn't need to be all official statistics at the end of the day. It can't be. So for instance, why not using, something that I don't understand is, we talk so much about private sector data, about the data from the GAFAs, the mobile phones, and all these kind of things. And we have been overall disappointed, in all honesty, using those kind of data for statistical purpose. I'm not saying for development, for other purposes. That's great use of the data, of course. But why don't we use more citizen-generated data? I've never understood why we never have sort of quality checks for citizen-generated data. And in particular, we have so many great groups working on specific issues that would be very pertinent to women's issues, schooling, health, and also, of course, to men's. So in that sense, I think that's something we maybe want to look into more, how we can, if partnerships to support this role of NSOs to be more moving from a production entity to a certifier, to be like coordinating agency is a long way, I know, but at least we should start at some point. And maybe this is a good time to start. Thank you.
Thanks, Johannes. Norma, it looked like you wanted to jump in. Please do.
Yeah, I would just say that I think that, and building on Catherine's point, one of the things that we as a community could do a better job on is taking those quick wins like the ones that Jessa alluded to and using them to make very explicitly and strategically to make the case for long-term, the kinds of long-term investments that Johannes is advocating. You know, I've seen from the NGO side, some of our partners who get initial traction when they solve a particular problem around gender data. And when they say, we were able to break this down by men versus women. Here's what we learned from that. Be actually asked by the decision maker for more, and say, we'd love to, and we need more funding to have a larger sample. And sometimes the decision maker says yes. So I wonder if there's ways that we as a community could more explicitly tie some of the quick wins that we're experiencing around COVID to specific asks around the highest priority long-term investments.
I hate to end there because I think that's an opening to an entirely other discussion that I would love to have, but we are running short on time. And so I just want to thank all of our panelists, Jessa, Mercy, Johannes, Catherine, Norma. Thank you so much for contributing to today's discussion and for sharing your perspectives and really highlighting the promise of partnerships, I think. I mean, I heard so many things. I won't try and sum it up, but I did hear that, you know, even fledgling partnerships really lay the groundwork for future progress in gender data. So it's important now. And, you know, the fact that there is this tension between data for now and building these administrative systems for the future, and these networks and these partnerships have a huge role to play in doing that. So thank you to our organizers of the Gender Data Network, Data2X, Open Data Watch, and UNECA, for leading the charge on establishing the network and really creating a model that could serve other regions. And lastly, thank you to our audience for logging in and sharing your questions with us today. So we look forward to continuing the conversation on how to improve gender data during the upcoming United Nations World Data Forum that's next week. And we'll of course continue the conversation beyond that. But that's it from me. Take care, everyone.
Thank you very much.
Thank you very much.
Bye-bye.
And bye, everyone. Have a good day.
Thank you.
Have a good
And
evening.
thanks, Kelly.
Thank you.
Thank you. Bye.